Hi, this is Madeline. I'm going to be talking about yellow fever caused by the yellow fever virus. The yellow fever virus belongs to the genus Flavivirus, belonging to the family Flaviviridae, and it is part of the group 6 of viruses. So that means its structure is positive single stranded RNA virus. It is an enveloped icosahedral capsid and approximately 50 nanometers in diameter. Part of the genus Flavivirus is that it is a viral hemorrhagic fever, and all viruses in this genus are transmitted by arthropods, meaning ticks or mosquitoes. It's related to dengue fever virus, Japanese encephalitis virus, West Nile virus, and Zika virus, and all of these are transmitted by the mosquito. Yellow fever is one of the first viruses to be identified in the Flavivirus genus, and so the genus derives its name from yellow fever, flavus meaning yellow in Latin. So there are four periods of infection with yellow fever virus. In infection, 55% of all infections are asymptomatic. For the 45% of those who are infected who do express symptoms, they go through what's known as the incubation period, which lasts for 3 to 6 days. And that's when the virus is incubating in the body. In the second stage, it's called the infection period, which lasts for several days, and there'll be flu-like symptoms, headache, fever, and general malaise. However, some will develop severe symptoms such as chills, lower back pain, muscle pain, nausea, dizziness, and decreasing pulse rate. And it is only in this stage that the virus is transmittable, but it's transmittable only to mosquitoes. In the third stage, it's called the period of remission, and this lasts for up to 24 hours. The symptoms recede, and in 80% of the patients, the virus is clear. However, in 20% of the patients, they will undergo the fourth stage of infection called the intoxication period, and that's where it becomes a viral hemorrhagic fever. There's high fever, dark urine, bleeding from the mouth, nose, eyes, and stomach, black vomit, and kidney and liver damage. And the liver damage results in a jaundice in the patient, and that's where yellow fever virus gets its name because of the yellowing. At this stage, the patient isn't infectious, which is interesting. Like I said, 20% of patients will undergo the intoxication period. If the virus progresses for 7 to 10 days, the patient will experience damage to the central nervous system, resulting in confusion, seizures, coma, or shock. And half of the patients who undergo this intoxication period will die within 10 to 14 days. The other half, though, will recover without significant damage or sequelae. So, yellow fever virus is transmitted by the mosquito, particularly the Aedes and Haemococcus mosquitoes. They transmit their virus. The mosquitoes can transmit the virus to eggs in what's called vertical transmission. The Aedes mosquito is the primary vector, but it also spreads the Zika, chikungunya, and dengue viruses. The primary mosquito is the Aedes aegypti mosquito, and it's often referred to as a yellow fever mosquito. So, according to the World Health Organization, the yellow fever virus can't be transmitted from person to person, cannot. However, the Centers for Disease Control says that it can theoretically be spread via blood transfusion or needle sticks, but there are no documented cases of this actually happening. There was one documented case in Africa of perinatal transmission where a woman developed yellow fever symptoms and then gave it to her infant when she delivered the baby, and the baby subsequently died. The reservoirs of infection are human, mosquito, and monkey. So there are 3 cycles of transmission with yellow fever virus. There's the jungle cycle, which is monkey to mosquito or mosquito to monkey. And these are transmitted by the mosquitoes that live in jungle areas. There's the intermediate or savanna cycle, which is mosquito to monkey to human or human to human through a mosquito only. And savannas are only in Africa, so this cycle only occurs in Africa. And then there's the urban cycle, which is the most common, and this is human to human by an urban mosquito. And in most cases, it would be the Aedes aegypti mosquito. So it occurs in the urban cycle when the human contracts the virus in the jungle, travels to an urban area, and in the stage of infection, infects a mosquito, and that mosquito will bite other people, and that's how people get yellow virus. And that is a slide of from the CDC about the cycles of transmission. So those who normally contract yellow fever live in warmer climates because that's where mosquitoes tend to be. Also in overcrowded areas in developing countries, not because so much of the big population, but because the water and waste systems are very poor. Yellow fever virus is endemic to 47 countries in Africa, Central, and South America. An average of 200,000 people a year will contract yellow fever virus, and 30,000 deaths occur annually. 90% of the cases occur in Africa as of data from June 2016. And the Aedes aegypti mosquito is, since that's the main cause of contracting the yellow fever virus, the World Health Organization says that there are approximately 2.5 billion people at risk. And here's a map from the NIH about who is at risk for contracting yellow fever. So diagnosis is difficult because it is similar to so many other viruses, especially in the early stages of infection. And then in the later stages of infection, it's very similar to other viral hemorrhagic fevers. And it's also confused with severe malaria, viral hepatitis, and poisoning. And where it occurs, other viral hemorrhagic fevers are likely to occur since it's prevalent in developing countries. But it's diagnosed by blood tests in a laboratory, and if the patient dies, they'll sometimes do a liver test. There are no drugs that treat yellow fever, but palliative care has been shown to cause a higher survival rate. So the death toll is big because it occurs in developing countries where they can't get access to health care. So there haven't been any documented cases where yellow fever survivor contracted the disease more than once. So that's one good thing. There is a vaccine available. It is a live attenuated vaccine, and it provides 99% of protection within 30 days of immunization. And it is not approved for children under 9 months, for pregnant mothers, those with severe allergies to eggs, and those who are immunocompromised. But if there's an epidemic in a region, the World Health Organization will make a few exceptions. So history. It is said to have originated in Africa and made its way to Europe and the Americas via the slave trades. And the first recorded epidemic, they believe, occurred in the Yucatan in 1648, and outbreaks would occur where the mosquito was. Carlos Finlay was the first to discover that the mosquito was responsible for the spread of yellow fever before it was believed to caused by gases. More soldiers died in the Spanish-American War due to yellow fever rather than from the war, and because it slowed construction progress of the Panama Canal, the U.S. government commissioned Walter Reed to investigate the cause of yellow fever, and he was the one to discover that the Aedes aegypti mosquito was a primary cause. So there were campaigns to eradicate the mosquito, and this was successful in Cuba and Panama, and eventually in North America and in Europe, they virtually eliminated that. They did eliminate the Aedes aegypti mosquito, and the last epidemic of yellow fever in either North America or Europe occurred in 1905. Before that, it killed 100 to 150,000 people in the United States. Max Teiler was the first. He was the one to produce the first vaccine for yellow fever, and that strain is still in use to this day, so it hasn't changed. It's the same vaccine that we use, and he won the Nobel Prize for that research. So similar mosquito reduction programs occurred in the 1940s, and this successfully eliminated urban yellow fever cycles of transmission in the Americas, but jungle and intermediate yellow fever transmission still occurs in both South America and Africa. So the World Health Organization considers one confirmed yellow fever case in an unvaccinated population as an outbreak. In South America, those who are infected are usually young males because they actually go to the river basins and forests where the mosquitoes that transmit the virus are. And the most recent outbreaks of yellow fever occurred in Brazil in 2016. So in Africa, outbreaks occur every year in Africa. And in 2006, World Health Organization launched a yellow fever initiative, and this vaccinated many people. But a huge outbreak occurred in January 2016, and 345 people died. So in late 2016, World Health Organization launched another campaign called Eliminate Yellow Fever Epidemics, or iStrategy, and it hopes to eliminate yellow fever by 2026. So they're going to focus on 40 countries, and they're going to work with industry and private companies to protect workers who labor in forests, which is something that World Health Organization hasn't done before. So they're going to do that with this campaign now. So they're not focused on any vector control. They're just focused on surveillance, assessment, and immunization. So 16 African countries require yellow fever vaccination before entering the country. And there are 10 cases of yellow fever in unvaccinated travelers from the US and Europe between the years 1970 and 2018. 8 of these travelers died, and in one of them, the case of infection was in a vaccinated traveler. They're just not sure how he contracted the virus. So the only way besides getting the vaccine to prevent yellow fever is to prevent getting bitten by a mosquito. So just the obvious tips to stay indoors, apply insect repellent, etc. So ongoing research, the NIH is conducting research for a new vaccine that could be used by pregnant women, elderly, immunocompromised, and infants younger than 9 months. It's another attenuated vaccine and is currently in phase 1 in development. They're just trying to allow the vaccine to be administered to more people so that it can save more lives. So that's all I have. Thank you.